Mhm. Hi, good afternoon, and welcome to CIO Leadership Live. I'm Mary Fran Johnson. I'll be your host for today's show, and I'm delighted to be welcoming Letty Nettles to join us today. She is the CIO of Novant Health. As the Chief Information Officer there, Letty has been focused on leveraging the right tools in the rapidly evolving healthcare technology space to meet the strategic business goals of the company. She has 20 years of experience in business pattern recognition and technology implementation, along with a proven track record of organizing complex business structures and successfully transforming operations. For those of you not familiar with it, Novant Health is a 3-state integrated network of physician clinics and outpatient centers, including 14 hospitals across North and South Carolina and Virginia. It's headquartered in Winston-Salem, North Carolina, with more than 1,200 physicians, 26,000 employees, and nearly 500 locations. Yearly, there are 4 million patients across those states served by Novant Health. Before she joined Novant, Letty served as the VP of Digital Technology Strategy and Portfolio at Baker Hughes, which is an oil industry company that is now part of General Electric. Before that, she held high-level enterprise positions managing technology strategy and enterprise architecture at places like Rent-A-Center, Walmart, and Dell. Her impressive resume runs the gamut from corporate executive and IT leader to enterprise architect and even startup entrepreneur. Pleasure to have you here with us, Letty, today. Thanks for joining me.
Of course.
Let's start out talking about your diverse IT background and all the business experience that you're bringing to Novant Health, because it doesn't have a lot of healthcare and hospital experience in there. So I think it's always fascinating when you see CIOs leaping across different industries, and you've done oil and retail and computers and technology. So what are the things, what does that enable you to bring to the table as the CIO now of Novant Health?
So the common thread is the consumer, the customer, right? So coming from the retail industry and leveraging technology, we've spent decades putting the customer first. So we know how to align the technology to get there. Do we know how to align the teams to think about the consumer first? So as healthcare, as we know, is kind of a late adopter to this digital disruption, which means putting that consumer first. Our CEO has taken the bulls by the horn and is leading, a charge to try and get that consumer experience, improved and patient satisfaction through those experiences using technology. So one of the reasons I did join Novant was the ability to be able to take, complexities, complex businesses, and organize them so that we can inject the technology in the right locations so that it benefits our consumers and our patients and our providers.
Okay. Well, one of the things you noted when we talked ahead of time was that the CEO of Novant Health has really been doubling down on technology and on the digitization of the business. And that's always great to hear from a healthcare organization, because a few years ago, healthcare was not one of the leaders in areas like this. So talk a little bit about that.
That's right. He is probably one of the first healthcare CEOs to add a chief digital officer to his executive team. Angela Yoakum joined the organization just about 2 years ago, and then shortly after brought me over to help with this digital transformation revolution. So, he has spent a lot of time and energy and focus really embedding technology across our senior leadership team, across our strategic planning. Angela's playing a huge role in that push.
Yes. Well, and you mentioned, too, that Angela, a lot of what she does is she's kind of educating her own peer group and the CEO group about how technology could be a more direct channel to patients. And that certainly sounds like a concept from the retail industry and from even the technology industry. What is the direct-to-patient opportunity, and how are you taking advantage of it?
Yeah, it's huge. When I got here a year and a half ago, I did a lot of the comparisons between, what was our thinking internally? How did we approach technology? How did we approach, solutions? And it was centered around the technology to enable hospitals and the acute systems and technology around our clinics. And, coming off of Walmart, one of our biggest transformations was that digital disruption. So I started aligning super centers to hospitals and, grocery stores to the neighborhood markets to the clinics. And so there's a whole world out there in that digital space, in that e-commerce space. And disruption happened when you started crossing those channels. So, standing up and getting the mindsets around an omni-channel concept, right? The banking industry does it, retail does it. So our consumers are very educated and have this now expectations for healthcare to do the same.
Yeah.
So over the last year, we've been really focusing on, and we'll talk about a little bit later on, but trying to create that omni-channel experience and getting, leveraging those devices that are in the hands of our consumers to help not just share information and patient records, but also to deliver care in new ways.
Well, and when you talk about an omni-channel experience in a health industry business, like, essentially a nonprofit hospital and set of clinics, I can imagine incoming patients wanting to use their devices to schedule appointments, but then my imagination starts to fail me. What else could we be doing in the healthcare industry where we're expecting our devices to essentially be part of the solution?
Yeah, more than scheduling, of course, patient records, but we're also getting into diagnostics, self-diagnostics, being able to capture, readings and metrics about yourself, planning. Or coordinated care for your family members, right? There's transportation, like there's a whole list that by leveraging that technology in their hands really does open up the opportunities for us to create a better experience and a more end-to-end cohesive experience.
Can you give me an example of that, of something you've seen change since you got there as the CIO a little more than a year and a half ago?
Yeah, so one of them was our ability to quickly deliver, when an idea happens and, being able to get it actually implemented. We went from a project-based thinking with, business justifications and a lengthy approval process to more of a quick, and lean, agile implementation. And one of the things was our chief medical officer found an application that was a mobile app that leveraged AI that allowed physicians and neurologists to be able to see brain scans quickly, on a mobile phone as they were happening, and use AI to help do some predictive analysis around the level of risk. So we were able to identify that solution and get it implemented and have the first patient reading within 4 months.
That must have been pretty impressive to the doctors that suddenly had that in their hands.
Yes.
Or
yes.
I don't know. You can't tell these days with the whole omni-channel expectation that we all have, whether people look at something like that and say, "Oh, about time you did that."
Yeah, our physicians are doing a fantastic job recognizing that, that we are part of their team and that they are also part of bringing these technologies to, our patients and to other providers to help benefit, right? So so it's been very, very impressive to partner with them, and then they receive the technology and use it, and we can get the feedback right away. So it's a great partnership starting to form here, and I'm looking forward to the new things that we're going to see, because we can leverage our providers to be reach for us to actually do the R&D and do scouting on other technology and have ways to bring it in, because those sales companies and those startup companies who've come up with phenomenal technology are going to try and sell to the providers. And so I have access to those providers. So we're saying, hey, bring that information into us and let's take a look at it and let's unpack it and figure out if we can get it deployed.
Yeah, that I'm always interested in anything that is innovation-related, incubator relationships, that sort of thing. Do you count on the provider ecosystem to bring those opportunities to you, or do you yourself, or maybe some members on your team, get more directly involved with some of these startups?
Both, yeah.
Okay. Hmm.
We've talked about, with the goal of agility and speed. It's not just quick to deploy, but it's quick to deploy, and then maybe even uh, uninstall it and install the next best thing.
Hmm.
Because for healthcare being the late adopter to technology, there are the advantages of now we sit on the consumer side of the aisle and we get to pick and choose which technology do we want to integrate within our platform,
Wow.
and
Hmm.
and we'll use it. We'll use it until it's no longer the best thing, and I can unplug it and put something else in. And so by working with our physicians, when we talk about intake, it isn't submit a form. It is call your counterpart, your product
Hmm.
owner counterpart, and talk about what it is you're seeing, and we'll take a look of that specific portfolio, the total cost of ownership, the money we're spending, the projects that we have,
Hmm.
and start looking at what's the right sequencing to do the next level of improvement. Having a continual improvement model allows us to be able to shift and prioritize the right things to deploy. So we're always deploying. It's just a matter of what. And those providers have been great partners in helping us really figure out what's the right sequencing.
Wow. Well, and from everything that I've learned about IT organizations over the years and from all the CIOs I've talked to, it doesn't sound like that sort of approach is what you would typically expect. So, talk about the technology operation, which has a new name. You've rebranded IT, you and Angela. And how do you make how do you take a legacy system that everybody's got one and turn it into a kind of product-focused delivery system the way you're talking about?
Yeah. So coming off the last year and a half of it,
Yeah.
it was actually been very successful.
Hmm.
First thing we did is we really did stand up what we called a digital business office.
Hmm.
It includes our strategy organization, includes performance metrics, and includes value.
Hmm.
And so what the first thing we did was really look at organizing, taking, what we didn't want to do is come in with some industry standard, here's the capability construct for healthcare.
Hmm.
Having a non-healthcare person come in and say that, you just would get booed out of the room. So what we did is we took our current CMDB,
Hmm.
our application inventory, and reverse engineered it and look at all the capabilities that every application that we use within the system, what does it do? And we just started normalizing it and synthesizing the data and organizing it to say, oh, we're in the business of, we're a services business and we happen to deliver care. So we have a whole set of care capabilities, and our
Hmm.
product teams are centered around that. We have product
Hmm.
teams centered around those. And then we noticed another, grouping of, it's the business of care. So revenue cycle, credentialing, a whole bunch of capabilities that are to enable care. And then we had our other capabilities, which is the business of Novant Health, so
Hmm.
corporate functions and HR. And so what we did with that is we also put DPS, digital products and services, on the map as well. DPS is also a business, so treat IT technology as a business with, objectives and operational goals, revenue contribution capabilities. And so as we started to organize the concept, go from a concept to actual physical, the first wrong version of
Yeah.
our capability construct, we just started socializing it. And by the end of the year, last year, we now all have the same language. We shifted from our business
Mm.
partners coming and talking to us about an application to shifting to talking about what capability are you working on? What are you trying to improve?
Hmm.
Is it functioning the way it's expected? Because as a CIO, one of the first things I wanted to do is say, how do I know our technology products are doing what they need to do if I don't have anything to measure it against?
Hmm.
Right? We can't have the best of everything, but we can have the best of the things that we need to have the best of.
Yeah.
So working across my peer group, our leaders and our teams, the language resonated with everybody, and that's how we started to build those relationships, and get at the table, start having the strategy conversations around that capability. It's the same team who's looking to design the future and the same team who's doing the implementation and also looking to do the support.
Hmm.
So it's all focused on focused teams, and I can have as many priorities per number of teams instead of one priority for IT.
Right, right. Well, and this sounds very much like it plays directly into your data your data focus, the way you have reorganized businesses before. So the Did Novant Health have all the data in hand that you needed to see when you got there? Or
Absolutely.
was there, okay, and you just recently
Yes.
added a chief data officer, I think you told me,
Yes.
yes?
Yeah. He joined about the same time I did,
Oh,
and there's two sets of data. There's the operational or the data that we're collecting from patients, and we're collecting from within our system, and we're centralizing it. And our chief data officer is centralizing it.
mm-hmm.
His name is Carl Hightower, and he is doing a phenomenal job, making it available so that we can do the, data and analytics, and apply AI to those things to drive more insight.
Great.
The other data that I speak about whenever I start looking at the capabilities is the operational data, the things that we're doing on a day-to-day basis through the application set that our users use.
Mm-hmm.
So instead of going and interviewing users, what is it you do? What does he want to do? I can see it. So we took a look at that
Mm-hmm.
and figured out, I don't want to know how we do things. I want to know what it is we do. And then we can start looking at, driving costs down, or where do we drive efficiency, or where do we have to have
Interesting.
top level investments. And that business architecture concept is the beginning
Mm-hmm.
of being able to have that relationship with our partners, and then being able to translate it into solutions and technologies.
Excellent. Okay. We have our very first question from our LinkedIn audience, and I should have said this at the top of the show, but we are streaming live onto LinkedIn and Twitter and IDG's Tech Talk channel on YouTube. So if you are listening with us live and you're interested in sending in a question for Letty, we're going to do our best to get to every one of them. And since we were just talking about data, we've got a question now. Can you discuss the approach to privacy and security of data as you open omni-channel access to health data? It's a pretty good question. All right.
Yeah. So should I play the no, I can't discuss privacy data? No, the approach, we do have our CISO is involved in everything that we do, and all the platforms that we build that have access. So since we are building digital platforms and we're building an interoperability capability between our medical records and our digital platform, we have continual security views on that. Where the risk comes in and we have more heavy lifting and more evaluation to do is as we bring in third-party vendors to who are going to be involved in helping and have access to that data. So there's some rigor to it. We have an architecture review board. We have people constantly looking at it and helping us vet these vendors and the technology that they're using and the technology that they're using to make sure that we are on point. But our CISO, Jeremiah Grant, is really known within the healthcare industry for being able to predict and plan and remain, keep us
great,
safe.
Great. Are there any inherent difficulties when you change from kind of the classic project focus for healthcare and then move to the products and capabilities? How do you make sure that the security and the privacy issues don't somehow, fall by the wayside? Is that part of an approach using a business architecture?
So our security, the same way we do, we talked about experimentation as a service, security as a service as well. They too are mission-based teams to go in and work with each of the product teams to make sure that there's all the solutions, the applications within the portfolio are under review. And anything new that comes in, like I said, they're part of that architectural review board.
Okay. Well, I like, actually, we have another question, which it jumps ahead a little bit to when we're going to talk about future and some of the emerging technologies, but I think it's a great question right now as well. Do you think eventually in the future, healthcare providers will move toward a blockchain type system to improve accessibility of information between offices and providers?
Yeah,
There's been so much interest in blockchain, and for the last 2-3 years, I keep asking CIOs about it. Do you have anything in production, anything you're actually doing with it? And usually there's a lot going on, as proof of concept and that sort of stuff. So what do you think about that?
Yeah, we don't have an active proof of concept in the blockchain. We haven't seen the need for it. And, again, a value of being a late adopter to technology. We're not going to let the emerging tech be the tail that wags the dog.
Right.
We're going to be very, we know the areas we want to focus in. And when it comes to patient experience, and AR and VR and AI, those are the things that are helping enhance that experience, quality, safety, and experience. If something does come up that's fantastic, we'll definitely look at it, but it's done by each product team, each product and capability group. It's the technology owner and the business owner partnered together, who is looking at what kind of void do we have, or what kind of leapfrogging can we do, and what does the industry have in that space. And blockchain hasn't come up yet. Maybe it will, but we're letting that be a something that those teams look at on an individual basis and can raise their hand, and our experimentation as a service can come along and help it get it implemented.
That is, I've heard about a lot of various things as a service. Experimentation as a service was new to me. I want you to talk a little bit more about that.
So that's the need to be able to quickly, test things out. It's not so much of a pilot, but actually get it usable. Quickly get through the contracts, quickly get through any kind of funding, quickly unpack the technology and see if it fits within our tech estate. Right now, this speed is so important. And if we get these things done right through experimentation, we can plug it in. The experiment is to help us. If we decide it's not for us, then we just unplug it. Right. So this concept of being able to move into this module based, easy to use, quick to use, and quick to remove as well is key. And talks about definitely security is an aspect in it too as well. But that's the internal building that we're doing to be protective on those things.
Okay. And we have another question related to privacy, wondering if you foresee the GDPR type legislation, anything coming toward the healthcare industry at the federal level.
I think everything's coming at the
everything is coming at the healthcare industry.
I'm not an expert on that level of privacy. But I do know that we are preparing ourselves for everything.
Yeah.
One of the things we talked about on the digital disruption is, since we are late to the game, instead of letting that disruption happen to us, that internal disruption for ourselves, to be ready. So we do have governance teams. We're aligned with our legal teams. We've got, CISO, our security teams, our data teams, and our EMR team, right? Our records team. We all know how to work together and come together for any kind of mission-based, I don't want to say crisis, opportunity that we can come together quickly and do it. And that's why we spent a lot of the time, last year really getting this common map and this common language, is that, we can't predict everything that's going to happen in the future. So, be ready, be trained, know how to run the plays. When you're called to come to a mission-based team, you know exactly what you're going to do.
I like that. Run the plays. Yes. I was surprised when we talked earlier, because I expected that there would be like separate functions, like an innovation team or the experimentation as a service or an AI team, but you basically insert those resources as they're needed in the different product teams. Talk a little bit more about that and give me an example of how well that works.
Yeah, so far so good. So we do say innovation lives everywhere, right? So there's not just one, if you think about innovating in a particular capability set, you need a combination of the subject matter expertise and the technology expertise of where we are today and where we're really trying to go. So, we expect those individual teams to be responsible for the level of innovation that they are adding into their backlogs and at the rate in which they're deploying. what was the other half of your question?
Let me see. The other half of the question, that's a good question. I tend to be thinking about the next question while people are all
I'm
asking
sorry.
it. No, that's okay. It was about the idea that you essentially send them out. They almost sounded like you drop in a few ninja teams as they are needed. And I wondered if you had a specific example about kind of a show and tell on that.
Yeah, so good call. Yeah. So our data team does go around. Great. Since we have a lot of AI technology products that are being looked at. One of which is around patient flow and around patient flow specifically for our oncology patients, so that they're not having to wait. So the concept is a no wait room, and so my team is responsible for that clinic and all the technology supported in it. And we needed the ability to be able to leverage a vendor who had a set of data who helped us do this management of it. So the experimentation team was able to bring in a solution expert as well as bring in some of our data and integration experts and put it on that product team. And hopefully we'll get some. We did a experimentation this last fall, and we'll have more of it deployed this summer and this fall.
Awesome. And I should have asked you this a little earlier. Talk about the size of your IT team, because you're not doing this with 10 or 12 people.
Oh, no, not at all. We so our DPS organization is probably over 1,000 people. It is a mix of both full-time, supplemented contract services, as well as some outsourcing partners. So, we did take a lot of our, we did spend some time building some relationship with some partners to really help us, do better at some of the things like, automated QA and things like that. We're also looking to expand and bring in partner with, some local area. I don't know if I can give the names, but to partner in some co-creation and some innovation labs, leverage their technology, go to market together,
Great.
With certain technology. And so the 1,000 would be the actual, head count that we oversee. And there's so much more when you look at the partner lens.
Well, and that also good. I wanted to give everyone a sense of the size of the group you were dealing with here, or it's more like a whole division of a large corporation, because the next question is about the cultural changes that needed to happen or that have been involved in implementing this kind of product solution approach to it. And there is also in the question is combined with the ethical and the security aspects. I think we've hit on a lot of the security stuff as well. Yeah. But talk about the cultural changes that you as the CIO have needed to drive forward, and where are you in that journey?
This is one of the things I actually love to brag about.
Good.
Novant Health has been amazing in being willing and open and driving change. In other industries, in retail, in those other large corporations, change is hard. Like, you expect a transformation to be, 4, 5, 8-year effort. And what I'm seeing specifically with Novant Health is that being able to put the patient in the center makes all people work well together. So when you start to show that the value of the change, the value of the thinking is enabling our ultimately benefiting our patient and the patient experience, and specifically those outcomes, people gather around the table and they listen, and then they participate. So it's been wonderful to really, as a CIO, drive that change, because they're listening and they want to help, they want to be involved. And the more the merrier.
Right. Well, and healthcare just in general is so mission-based and so much in touch with essentially everyone we know and love has got to involve themselves with the healthcare system. In a lot of ways, it's like the technology we have in our hands. Everyone thinks that their smartphone just made them into a CIO-level executive because they understand about how to work their apps. I think we all have opinions and thoughts and feelings about the healthcare system because it's such a universal experience. that everybody has in their lives. Let me see. We have another question, and this one, I think our audience is clearly paying attention, so kudos to all of you out there. Can you talk about performance metrics for Novant Health and the impact of the ongoing digital transformation on those metrics?
I can, but I'll specifically talk about the technology performance metrics, and not so much our business metrics, since that's not my area.
Well, exactly. That's fine.
But that's the first thing we're measuring is the value. When we say value, that means doesn't mean anything with money or financials like it does in the retail world. Value of the technology means, is it moving the needle on the priorities that we're measuring for those capabilities? For example, in our radiology space, what is it that business wants to really improve on? And so I anchor our technology products to create an algorithm that says this value moves those needles, therefore we are in a good spot.
Okay.
So we're leveraging a VFQ kind of simple focused metrics, which is value, flow, and quality. What is the quality of the product? Because this is year one that we're teaching our teams to think in terms of product. It's no longer on time, under budget, because that doesn't necessarily mean we are delivering the value we need. It is now, what is the value? And is it being recognized at the consumer's level? So the provider or the patient or the employee. What's your flow look like? So getting the teams to think in terms of the backlog and how quickly are you pulling things off the top half or top portion of that backlog. And then quality of the things that we're delivering. Like, there's a difference between MVP one and something that's not working, right? Because we got it done quickly. And so being able to balance those things and make sure that the things are usable and they're helping. And if they're not, then don't deploy it. So we stuck with those three metrics to looking at our technology. And then the underlining of those, there's a whole bunch of other metrics like tech health, architectural security, knowledge base, like how many people, SMEs, the number of SMEs, have this knowledge. So we got a little complicated, or not complicated, complex in our strategy team, and is looking at the algorithms to truly measure products, the TCO, what's the cost to sustain the technology for this capability. But at the end of the day, we call it a win when we know what the value is and how we're performing against it.
And I'm sitting here trying to figure out what a SME is. Is that
SME, subject matter expert? I'm sorry.
Oh, okay. I was system something engineer is what I was thinking, but subject matter expert. Great. Let me see. We have another. This gets a little more specific. Can you discuss how quality payment programs, private and public, have changed the way you collect, analyze, and share data?
No, but I could.
I know I can't answer that, but how about you?
I could. Well, I've got teams of people who could probably get into that. I mean, it's kind of specific. Maybe in a couple of years or in a year, so I can get there. But I can tell you this. About the patient or the payment process and the revenue cycle is what I've learned that it's called here in the healthcare industry. That is not a back office function. Right. It is. I consider that part of the care capabilities. It's just the business of care because it's part of the patient experience. Like the patient overall experience isn't just when the provider is providing care. It is that booking that appointment online. It is understanding, before you go in, that price transparency, that cost transparency, and afterwards. So managing those expectations, one of the things that we always said in the Walmart world is exactly that. Like the expectation of the experience is increasing over time. People want things, they want to know, what's it going to cost me and can I get it for free? And so by taking that consumer, expectation and applying it into healthcare, I have one of my acting VPs, Ryan Neves, who is responsible for our revenue cycle services capabilities and a lot of the the Care Foundation platform capabilities. He is the complete expert in this area. He's been in healthcare for quite some time, and he could probably talk extensively about the things that we can do in this space. Some RPA emerging tech that we can leverage, and some other vendor solutions that make that visibility into that. But the value-based care components of it, I'm learning. I'm trying.
Yeah.
I'm trying to get there.
Well, you do have a lot going on, so you're not expected to know every answer out there. Absolutely. Now, I wanted to circle back, since we're talking about revenue and the different ways that healthcare is essentially set up, and you have worked always for very much for-profit, revenue-driven type businesses, but you're in a place with a whole different mission now. But I noticed that one of the things we talked about earlier, that you spent time with a lot of the healthcare leaders on the administration side, helping them understand the total cost of ownership on their side.
That's right.
Talk about that experience, and how you get them on board when you come in and tell them that that funky old tool that everybody knows how to use and you love to death, we're going to replace it with something that's better for the patient. Human nature being what it is, people are going to probably balk at that. So how do you have those conversations? How do you get them on board with TCO?
So those are two different conversations. The working with the provider, who is the user of the tool and has that direct experience with the patient. I fortunately have a partnering chief medical informatics officer. Excellent. Who is cut from the cloth of the physicians, who can help with that story and that translation and the importance of that. But similarly, the support, the business of care, which is the administration side, those conversations are business conversations, looking at, because there is a desire to make sure financially, and our health, our quality scores and safety scores, all the scores are firing at all cylinders, and we're operating at a high performance. They welcome the conversation. They actually welcome the transparency. One of the first things we did out of our digital business office was create some financial transparency of where's the money going. And we spent a lot of time translating, yes, you fund cost centers, but now I'm going to turn around and map it back to capabilities. So you can see how much of it you're spending towards the things that are directly to our providers and patients, versus the things that are directly provided to our healthcare administrators, and the things that are to our employees. And is it the right mix? Right. So, and we can constantly do those trade-offs. It doesn't have to just be once a year, but we can start having that. And so that transparency into those financials has been welcomed by, our presidents of the hospitals, and of the area, because they just knew it was money, and they need to figure out, are we spending it in the right places? I said, well, I'll show you where we're spending it. Do we need to make some changes? And we can make some changes. So it's welcomed.
And that might have been the first time they were having that experience, because it's usually not the CIO who is sitting down. They would usually expect someone in the finance office to explain that to them.
Yeah, the finance is at the party, right? So finance and the healthcare administration and technology, we're all sitting together looking at how do we spread, and how do we do the trade-offs? We've over-invested in here. Maybe we can shift some of the people and that money and the resources into something that we haven't invested in that need its time, right? Okay. So, the understanding of the, life cycle, that if you don't invest in or sustain it, that it will decline, and that will require more investment. That language is going off fantastic. They get it, they understand it, and I expect in 2020 that we'll be able to pull on that lever a lot more and to see a lot more progress.
Okay, well, great. Well, speaking of 2020, I know that you just last week wrapped up some pretty heavy-duty team strategy meetings talking about the coming year. Tell me about your projects and the things that you're going to be focusing on, both you as the CIO and where you're directing your teams for 2020. What are your big issues going to be?
Yeah, so that actually, instead of us just naming them,
Uh-huh.
we actually let the data do the talking again, in the same way we kind of reverse engineered our database of apps to find capabilities. We studied, and we're in the middle of studying all of the project requests or improvement requests that have come in from our business partners and from the teams, and started identifying what are those value streams or those value chains that these are rolling up under. And it's those stories that we will push and sell as we do, ops reviews, or as I join the monthly strategy reviews of my business partners. Tell them, don't talk in terms of projects, but talk in terms of those value streams. And some of the ones that are coming up that we are seeing is so we have a digital health business that we're standing up that is really going to be centered around that direct to patient, caring for the patient outside of the walls, and then not just expanding past the walls, but also expanding down that care continuum to when the patient is healthy and is well, right? So how do we continue to support them and be there to help them through their non-sick times as well. So a lot there. And so there's, in order to do that, as we've had our chief medical officer who's responsible for digital health, Dr. Hank Capps, he has spent a lot of time researching those devices and what's in the industry and what he's shopping, right? He's shopping in that market. And so, back home in our tech estate, we're building a digital platform that will allow us to plug in those devices, that will also allow us to do streamline interoperability with, our Epic, EMR backend platform. So digital health, enabling digital health as from a product delivery perspective and as a business model perspective is definitely a theme for the year. Some of the other things we're looking at is, how do we continue to serve and let our business partners drive, strategic view of where they're going and how can we enable it. So we've got some things on the radar that's, swapping up some platforms such as our radiology platform under conversation still, but we've got some credentialing, capabilities, things that have been heavily operationalized, and where can we leverage some emerging tech or new tech to really accelerate those things. We've gotten really good at maintaining and upgrading our EMR platform. So we plan every quarter to do
EMR being your electronic medical record.
That's correct.
Yes.
And then we've got some things around patient acquisition. So same day appointments. We're also looking at leveraging some drones to help with delivery, working with our pharmacy capabilities. So, we're still figuring out what the rest of those value streams are. Referral management is huge. How can we get patients to have visibility into what we know as, the right referral, and getting them access to that. So we're still bubbling up what those value streams are, but as you can tell, there's so much out there that we've got to make sure that we don't solve just that low-hanging fruit. Like, we use it as an opportunity to think further and into the future of where we're trying to go, and knock out a whole bunch of things at one time instead of just one low-hanging fruit at a time.
Well, it's such a different approach and a way of thinking about healthcare IT delivery, because a few years ago it used to be all about the Epic systems and about EMR, and it was, I don't know what percentage of hospitals now have fully electronic medical records. I know it's kind of like the SAP challenge or the ERP, the ERP challenge for the healthcare industry. And hopefully the last time I looked, the percentage of hospitals that were fully electronically medical record arranged was still very small. It was still under 10%. But you had mentioned when we were talking about revenue generating. And I always bring it up with CIOs because sometimes people have a project going on that plays right into that and is interesting. And I didn't really expect you to have anything on that. I thought, it's a healthcare business. You're not really in the business of trying to generate more revenue for the company. But I was wrong about that. You've got a consulting team. You've got investment in medical records. You mentioned the fact that there are capabilities in your big EMR system, which is that industry standard Epic system, that there's capabilities that allow you to actually create small subset products and then bill some of your partners for it. Explain a little bit more about that.
Yeah, so as a nonprofit organization, we really can, teed it up as we are contributing to top line revenue by leveraging the investments that we've made within our Epic platform. And the goal there would be, is really around that patient experience. We want, our population and our communities to be able to go where they need to go, but have their information available. So of the providers and the clinics that are not themselves on an EMR, we have a offset product that is integrated with our investment into our EMR that allows them to leverage it and use it and capture that patient data. So our health records exchange, and from what I know of it, is pretty fluid. And it's being adopted widely. Okay. So that's one of the components. The other things that we so outside of investments in product, we have investment, we've invested in our resources. So as we have expert EMRs, we have expert security consultants, we have expert strategy consultants that as these other companies look to deploy in some sort of technology, whether it's ours or they've licensed their own, we've got some healthcare specific expertise that can really help in that launching. So, so being able to, play a part in the actual delivery and leveraging existing investment to drive revenues, been a big win. And in 2020, we're also hoping to, continue to expand that further and partner with some of our, corporate health and corporate wellness business partners to be there and offer more technology through that channel from a direct to employer channel. So there's several channels that from a growth perspective and a strategic growth perspective that our DPS organization is being tapped on the shoulder to be a part of those things, sit at that table around the strategy of it so that we can look at what do we have internally, how can we partner with somebody to help us work and capture patients who would benefit from a lot of the things that we're offering.
Now, did you, and working with Angela as the Chief Digital Officer, did you set up different structures for the partner ecosystem? I mean, every IT operation in the world has got partners that they rely on. Sometimes they think of them more as vendors than as partners. But when you get to the point where you really are working together on things and they're sharing resources on the R&D front, it really becomes a partnership. But that takes effort on the part of the IT organization. So what have you and Angela set up over the last year and a half that is changing that relationship or maybe deepening it?
Deepening it. The digital business office that we stood up, right? Not only is it strategy and planning and investment and performance metrics, it's also our financials, our vendor management, and any kind of shared services. Also managing the co-creation labs, resources. So, it's truly, as think in the old world of the former, office of the CIO kind of concept. It's the same thing, but it's our digital business office, which supports across all of Angela's directs, the entire organization. And we have those experts in that team.
Okay, excellent. We have a question about what are your thoughts on transforming healthcare organizations so that they become real-time organizations?
Okay.
Okay, I know. I looked at that
no,
too and
great.
thought, I'm not
Uh,
sure. Yeah.
well, if
Mhm.
in places in pockets, I bet you that that is something that that does make sense. Real
Mhm.
time in not just the from patient data sharing, but the provider data. And when it comes
Ah,
down to credentialing, when you look at working with payers, that'd be great to see shorten that time
yes.
between being able to share that data, validate that data, and work with payers to get paid on that
Yes,
data.
exactly. Well, I know that and I probably other people have had experiences like this with their healthcare organizations. When you get blood work done or you go to see your doctor, especially if they have some sort of a patient portal, you can expect to see your test results by the end of the day. I mean,
Yes.
we seem to be approaching real time in several areas.
Yes, that's exactly the consumer model that
Yes.
that our lovely retail industry has trained our consumers to do. Expect it now,
Yeah. Yep.
expect it free, and expect that cost transparency, expect it better every time. So,
Yes.
bringing that into healthcare is absolutely what we need to be doing or what we'll be doing.
Well, and you made an interesting point when we talked before about the patient or the customer experience and expectations, that you don't need to teach patients technology because they are expecting this omni-channel experience. So this is, I've
Absolutely.
heard it called the Amazon effect or the Google effect. We don't tend to think that it's going to affect something as serious a business as healthcare, but it absolutely seems to be.
Yeah,
Yeah.
sure is.
Let me see. The experience of you have run your own company before. You've been an entrepreneur in your past, and you were talking a little bit with me before about how you were able to simplify the mission of what you were in business to do and how that affected you as a leader. So let's talk about some of your leadership, some of the lessons that you've learned over doing all those things from being the entrepreneur of your own business to ending up as the chief information officer now. What are some of the things that you have learned from that, and what would you pass on as advice to other CIOs?
Yeah, this was interesting because I think we've all learned so much over time, and I think the one thing that resonates, that continues to be a reminder for me, whether small, in a startup, or in a large corporation, is value. The value of your investment. Value has an expiration date, so
Mm,
just because you identify a solution and you have identified a market and you have identified a plan to go and you're generating revenue, you've got customers, yes, you can celebrate your win, but don't stop, right? You have to
yeah.
continue to be ahead and look at those, what are your customers expecting?
hmm
Because the value delivered today may not be of value in the future.
And so it's kind of a constant process of reassessing.
That's right.
Yeah.
That's right.
Yeah. That definitely does sound like a lesson from the retail industry, doesn't it?
Yes. And investor,
Yeah.
the
Yeah.
investor community too.
Well, and do you find in dealing with all the various levels of IT people that you work with as the CIO, IT people do love to solve problems, but they also love to feel appreciated. And
Absolutely.
when an organization is in the kind of sort of the beneficial uproar of change, that can probably be alarming to people. So, how do you make sure the staff is feeling like you have their back?
Yeah, great question. We have a communications model where we are celebrating the things that we release and we highlight. We have a phenomenal communications team led by Misty Fragan, who is really getting into the details and working across the product teams of who's doing what for what product, right? So we
Yeah.
switched it from it being about just the who and more about the what we're doing and celebrating that team.
Yeah.
And so, the feeling of knowing that your leadership is seeing the value, but we're not so much highlighting it as an individual, win. It's a individual team win. You play as a team. You have to play as a team. You got some people who do well at this delivery, but in the next delivery may not be the one running it over the finish line. So just that transparency into the team, showing those the the place that they're running, the value that they're delivering, giving them opportunities to have some executive leadership views. We started bringing our product owners, some who may not have, been a director and above, someone who sits at a manager level, but they're the product expert. They're the product owner. So guess what? They're going to the SVP strategy meeting and they're participating in them. So we kind of threw off the shackles of the org chart. Org chart is fantastic when we're doing leadership coaching and helping people with career planning. But we run plays, we practice and we drive points in this product model, and all badges are off, hierarchy is off the table over there. It's about, making that product and that capability successful. And we love to highlight, the teams that do well.
Well, that's good. And I think that I love that concept, all badges off, egos at the door, that sort of thing. It sounds like you've also needed a partnership, a pretty active one probably, with your HR organization.
Absolutely.
Yeah.
Absolutely. And they were fantastic in helping us because of all the movement and the quick movement we needed to do. We couldn't be hamstrung by HR and these job moves. So that's why we created a product. It's a role. They're roles that they play.
Yes.
So I didn't have to change managers. I didn't have to move orgs. I didn't need to go through that paperwork. We want our team members to have a relationship with their leader, but then they can hop across any product team and play any role that they want without having to move who their leader is.
And just last question I'll ask you is about the impact that all of these changes have had on your talent acquisition strategies.
Oh, it's great. This is the first time I've been on the East Coast. So, recruiting out of central, U.S. is
you
been
are
easy.
in North Carolina,
Yes,
it's not necessarily a hotbed. It's not Silicon Valley.
But I love it. So any chance I get a chance to promote it, I love it.
Good.
But, our talent has been great. The things that we're doing, we've brought in technology experts, into our organization. So, we're getting put on the map for the things that we're doing. Angela, you hear Angela's voice and, presentation and all of the, around the country about the things that we're doing. So we're able to recruit talent the way we're needing to. It's getting better because we're outward facing. Our CEO wants us to be, out in public and talking to other organizations and finding that right mix of talent, and then in training what we have, in-house today. We've got a lot of great healthcare, specialists, and now we're just bringing in, more technology.
Okay. Great. Well, we are very big fans of that here at CIO.com. Thank you so much for joining us today for this conversation. It's been really great talking with you. And thank our audience, too, for sending in such lively and complex questions. I'm always humbled by how a lot of the questions we get from our audience are much better than something I would have dreamed up myself. So I hope that you have enjoyed today's broadcast. If you joined us late, you can watch a full episode of my conversation with Letty Nettles. I've been talking with the CIO of Novant Health in North Carolina, and we will have the full episode posted later today on CIO.com. And you can listen to it by tomorrow as an audio podcast wherever you get your podcasts. And we encourage you to sign up and join our IDG Tech Talk channel, where all of the CIO Leadership Lives are listed. I think we're upwards of 40 of these interviews now and counting. And my next one will be on January 29th, when I'll be joined here in the afternoon by Mike Santamaw, who is the CIO at Rent-A-Center, which just happened to be where Letty and Angela Yoakum used to work. So it's a pleasure to be connecting up with this great group of CIOs. And we thank you so much for joining us today, and I'll see you next time.
Thank you.
You're so welcome.